Hi, everybody. Thank you so much for tuning in to this month's wellness workshop. The topic of this month is going to be on TMJ. So, this workshop is perfect if you or someone that you know is suffering from the jaw pain of TMJ. We're going to talk a little bit about the causes and effects and how we can help you reduce the pain. So, some of you may be wondering, what is TMJ? So, it's also known as Temporomandibular Joint Syndrome. It's kind of a mouthful though, so I'm just going to keep referring to it as TMJ. But basically, it's jaw pain. It's acute or chronic inflammation and pain of the TMJ, the jaw muscles, and the facial nerves. And myofascial pain is a major component of most types of TMJ. This pain can be caused by a wide variety of medical conditions, and it's actually very common. Approximately 12% of the US population is experiencing TMJ at any given time. So I included this diagram to give a better idea or understanding of where the TMJ is actually located. It connects the lower jaw, which is the mandible, to the skull, which is the temporal bone, in front of the ear. So basically, if you were to take your finger and trace from the left side of your ear, going over your jaw, your chin, the other side of your jaw, to the other ear, that's basically what your TMJ consists of. Now I'm going to talk about some causes of TMJ. As I just mentioned before, there's a wide variety of different medical conditions that can lead to TMJ pain. It can be caused by trauma, disease, oral habits, or even wear and tear due to aging. And trauma can be something such as grinding the teeth, clenching the jaw. This continual hammering on the TMJ can change the alignment of your teeth and actually cause that inflammation and pain of the membranes that are surrounding the joint. Trauma can also be an injury or an impact, such as from an accident, and this can cause dislocation of the TMJ or even damage the cartilage disc of the joint. Now, there are some diseases that can cause TMJ. So, osteoarthritis, like other joints in the body, the jaw joint is prone to arthritic changes, and osteoarthritis causes a slow, progressive loss of cartilage and formation of new bone at the surface of the joint. There's also rheumatoid arthritis. This causes inflammation in joints, and this can affect the TMJ. And as it progresses on, it can cause destruction of cartilage, erode the bone, and eventually cause joint deformity. And there's other causes: infection of the joint, cancer of the joint, and bone deformity that occurs at birth. So now I'm going to go over some symptoms of TMJ. So this could be pain in the facial muscles and the jaw joints, and this pain can actually radiate to the neck or to the shoulders. You can also experience muscle spasms if your joints are overstretched. Pain can occur with talking, chewing, or yawning, and when the joints move, they may produce a clicking or popping sound or noise. And the jaw may lock in a wide open position, or it may not even fully open at all. And pain can cause dizziness, it can cause headaches, and these headaches can even lead to migraines. It can also cause ear pain or tinnitus, which is ringing in the ears, and hearing loss. And sometimes people can mistake TMJ for because of how serious the pain in their ears is. So, how long can these symptoms last? Well, there can be acute symptoms and there can be chronic symptoms. So, for acute symptoms, these can last anywhere from a few days to a few weeks, and they can after the cause of the discomfort has resolved. Now, for chronic symptoms, these can be ongoing with episodes of sharp and or dull pain that occurs over an extended period of time. So, this can last for months or years. How is TMJ diagnosed? So it has to be diagnosed by a doctor. They're going to ask for your medical history, and then they'll do a physical examination, examine your head, neck, face, and the TMJ joints, noting any tenderness, clicking or popping sounds, and range of motion in your mandible. And then they'll do an assessment of your pain on a scale of 1 to 10 and check how your teeth align together. So, depending on the suspected causes of TMJ, the doctors may order a blood test to rule out lupus, rheumatoid arthritis, or gout, and x-rays may also be taken of the mouth and jaw, and an ultrasound may also be ordered to assess the function of the TMJ and the movement of it. There are a couple different treatment options for TMJ depending on your case is, but for chronic TMJ, a team approach may be required. This would include a dentist, a pain specialist, a physical therapist, or a doctor such as a chiropractor. There are different modalities that can be used to relieve pain and restore the function, so some of these may include myofascial techniques, manual or acupuncture trigger point deactivation, muscle relaxation, and muscle re-education, which is where normal movement patterns are taught. And you can also use physical therapy to help restore joint mobility, increase muscle strength, and relieve the pain. In some cases, Botox can be used in combination with to relieve the muscle spasms and the pain. And surgery is also a treatment option, although it is never the first choice of treatment for TMJ syndrome. Arthroscopy surgery is done when there's a suspicion of an internal problem with the TMJ, and arthrocentesis entails the use of a needle, which cleans and irrigates the joint. It does require anesthesia, and it does have a very high success rate in resolving the pain. Medications can also be used to help relieve pain, such as muscle relaxers or prescription strength painkillers. Now, with medications, it is important to keep in mind that although they are relieving your pain, they're not necessarily treating your pain, and you want to find a treatment option that will really get to the root of things and get rid of your pain once and for all. So, since we're talking about treatment options, I'm going to dive a little bit deeper into how chiropractic can be beneficial for those suffering from TMJ pain and the different treatments and modalities that would be used. When you get a chiropractic adjustment, this alleviates tension and dysfunction in the spine. This reduces the pressure on various nerves, which can then alleviate the pain associated with TMJ. If you're seeing a chiropractor specifically for TMJ treatment, the focus is going to be on the myofascial release of the medial and lateral pterygoid muscles. Intraoral palpitation is used to relax and release the trigger points in the medial pterygoid muscle. Therapeutic ultrasound may also be used, and this provides deep heat into the muscles and joints, relax those muscles, and increase the circulation. With regular trips to the chiropractor, many sufferers of this condition find ongoing relief. So I included these pictures to give a better visual of what the therapeutic ultrasound looks like. So this can be used either on the jaw, the neck, or even the back shoulders to kind of help alleviate the pain that people experience from TMJ. For those of you who don't chronically or regularly experience pain from TMJ, there are home remedies for treating that pain when it does flare up. It can be maintained at home by using anti-inflammatory and pain medicines, eating a diet of soft foods and avoiding biting anything hard. You can do stress reduction techniques to help you relax your jaw, as well as applying warm compresses. You can also do lower jaw movements or exercises. Now the question is, can TMJ be prevented? Well, if you tend to have occasional bouts of jaw pain, here are some things you can do to prevent it from worsening or getting any further. You can avoid chewing on gum, biting on hard objects such as pens or fingernails, and avoid eating hard food or candies. You can regularly massage your jaw, your cheeks, and your temple muscles, and if you do feel spasms, apply moist heat. You can see your dentist if you grind your teeth at night or find yourself clenching your jaw. And last but not least, keep alignment and adjustment with regular chiropractic visits. Now we'll wrap up with the prognosis. So for TMJ, the prognosis is generally good. Most people do really well with therapy and maintenance care, and the success of treatment really does depend on how severe the symptoms are and how well you comply with the treatment. But most people can manage the discomfort with self-home remedies. That brings us to the end of the workshop. If you have any questions, please feel free to leave them in the comments, and thank you guys so much for tuning in, and I can't wait to see you guys next month.